Welcome back to Antibody Basics by Biointron, Part 16. In this episode, we'll discuss therapeutic targets, specifically for cardiovascular diseases and atherosclerosis. Cardiovascular diseases are the leading cause of death worldwide. Atherosclerosis is a primary cause of ischemic heart disease and stroke. The inflammatory response in atherosclerosis also affects chronic inflammatory diseases like psoriasis and rheumatoid arthritis. Antibody-based therapies, as precision medicines, can tackle CVDs. Therapeutic targets include lipid metabolism and inflammatory cytokines. Here are some mechanisms of action for antibody therapeutics. Monoclonal antibodies specifically recognize and bind to target antigens with high affinity. Mechanisms include immune activation, so ADCC and CDC mediate immune responses, or signal blocking to inhibit growth factor receptors like VEGF to prevent angiogenesis, or immune checkpoint inhibition, blocking PD-1 or PD-L1 to enhance T-cell activity, or drug conjugation to deliver targeted therapy directly to diseased cells. Meanwhile, bispecific antibodies can bind to two different epitopes or antigens simultaneously. Mechanisms include bridging cells to enhance immune-mediated killing by bringing effector and target cells closer, receptor bridging to inhibit signaling by binding distinct receptors, or cofactor simulation to mimic natural cofactors to modulate cellular functions, or with piggyback mode, to transport molecules to specific sites within the body. There are several therapeutic targets in cardiovascular diseases. With lipid-related targets, we have PCSK9 inhibitors to reduce LDL-C levels and lower the risk of cardiovascular events, ANGPTL3 inhibitors to decrease triglyceride levels, beneficial for patients with hypercholesterolemia, autoantibodies against ox-LDL to target oxidized LDL to reduce plaque formation, though clinical efficacy remains mixed. We also have inflammatory cytokine targets, such as IL-1 beta, to reduce cardiovascular events by lowering inflammation, or TNF-alpha, which has had mixed results in CVD, effective inflammatory conditions, or IL-6, which reduces inflammatory responses but may increase lipid levels. Targeting lipid metabolism and inflammation are key strategies in antibody therapeutics. Here are some examples of lipid-lowering monoclonal antibodies. Alirocumab reduced LDL-C by 54.7% and decreased major cardiovascular events in an Odyssey trial. Evolocumab lowered LDL-C by 59% and reduced cardiovascular events by 15% in a 4-year trial. Their mechanism inhibits PCSK9 binding to LDL receptors, increasing hepatic clearance of LDL-C. Meanwhile, evinacumab reduced triglyceride and LDL-C in patients with familial hypercholesterolemia. Its mechanism was to inhibit ANGPTL3, promoting lipoprotein lipase activity. Here are anti-inflammatory monoclonal antibodies in CVD therapy. Canakinumab reduced cardiovascular events by inhibiting IL-1 beta, by neutralizing IL-1 beta to decrease inflammatory signaling. Tocilizumab reduced inflammatory markers but may have increased lipid levels, by blocking IL-6 receptor to prevent signaling. Infliximab and adalimumab had mixed results in cardiovascular outcomes despite effectiveness in rheumatic diseases. Their mechanism is binding and neutralizing TNF-alpha, reducing inflammation. Let's move on to bispecific antibodies. Bispecific antibodies are engineered to simultaneously bind to two distinct epitopes or antigens. There are advantages for targeting multiple pathways, enhancing immune response, and combining receptor signaling inhibition. Their mechanisms include bridging cells to enhance immune-mediated killing by bringing effector and target cells into close proximity, and receptor bridging, blocking signaling by binding two distinct receptors. Combining bispecifics with other therapeutic modalities for enhanced efficacy could be a future potential for them. Next, we'll talk about challenges and future directions. Off-target effects may have unintended interactions with non-target molecules that can lead to adverse effects. For example, anti-TNF-alpha therapies increasing risk of heart failure. Another challenge is variability in response, as genetic differences and pre-existing conditions influence therapeutic outcomes. This could create inconsistent results with anti-IL-1 beta and anti-TNF-alpha therapies. There are also long-term safety concerns, which requires long-term studies to assess sustained efficacy and safety. This has the potential for immune responses against antibody therapeutics. By leveraging bioengineering for enhanced antibody binding and specificity, and incorporating bispecific designs for multi-pathway inhibition, enhancing targeting specificity could be possible. With combination therapies, one may combine lipid-lowering and anti-inflammatory monoclonal antibodies for synergy, while exploring gene editing with antibody therapies to target CVD-linked mutations. Another possible future direction is personalized medication, where tailoring antibody therapies with patient-specific biomarkers and predictive models to identify responders could be possible. Incorporating AI for target identification and antibody design, while using nanotechnology for better delivery and reduced toxicity is also in the future. Biointron focuses on antibody discovery, expression, and optimization. From gene sequence to purified antibodies, it takes just 2 weeks. Biointron's high-throughput platform enables the rapid expression of recombinant antibodies in HEK293 or CHO cells. We guarantee the delivery of 100 micrograms to 100 grams of recombinant antibodies. Biointron is also a well-recognized leader in VHH antibody discovery and production. With our self-owned alpaca breeding farm, we offer a 1 alpaca for 1 project commitment and guarantee the delivery of multiple binders, high diversity, and large capacity. Biointron also has several other services, including but not limited to bispecific antibody production, where most formats can be produced, with thousands of bispecific antibodies already successfully delivered. Afucosylated antibody production, as afucosylation has been shown to significantly boost ADCC effects. Single B-cell screening, with 2 to the 10 by the power of 6 plasma B cells from immunized animals, hybridoma sequencing, cross-verified with 5 clones and 100% sequencing accuracy guaranteed, and both antibody humanization and affinity maturation for antibody optimization, as well as recombinant protein expression in the mammalian system, and a high yield guaranteed with our ECA-CC licensed CHOK1 stable cell line. Thank you for watching, and comment with any questions or topics you'd like us to cover next. Don't forget to like and subscribe for more.